Vanessa Fabbre, and we're here at the Be All Conference, the Midwest's largest transgender conference in Chicago, Illinois. And I have the privilege of speaking with Dr. Edwin Miller of Healthy Alternatives in Chicago. Thank you for being with us, Dr. Miller. So if you could tell us what brought you to this point in your career in terms of your training and experience, and what motivated you to start working with transgender patients?
When I retired from the university at age 65, I decided I need something else to do. Since I was trained as a dietitian, my primary motivation at that time was to help people with weight loss. I had a psychologist that was working with me who was involved with a transgendered person, and he asked me if I would be able to do that. I said, let me look at the literature. I looked at the literature, and there was nothing. So from my experience at the University of Illinois in endocrinology, we had a lot of patients who had panhypopituitarism. That means that their pituitary was not working at all. So we had to do replacement therapy with hormones, thyroid, cortisone, and whatever the sex hormone was that they needed. So I decided, okay, I'm going to do the same thing I did there. What I believe is that if you want to be a girl, you have to have the same level of hormones as a girl. You aren't going to get that by putting a patch on your skin and expect to develop that much, or take birth control pills and think that you're going to get high enough. So what I do is that I start people on very low dose, gradually increase it over time. And I have what I call a slow track, which the medication level changes every month. Fast track, it changes every 2 weeks. On a slow track, I see them in 4 months. On a fast track, I see them in 2 months. We find out what their hormone levels are, and then increase it as we need to get them where I think they ought to be. We also give them spironolactone to block the peripheral utilization of testosterone. A lot of people think that spironolactone blocks the production. It does not block the production. The estrogen is going to block the production, and when we get to where they need to be so far as level of hormone for females, then I may start them on progesterone, which just kind of finishes things off.
So what makes a good candidate for this type of therapy? Like if someone is considering coming to see someone like you with your skills and knowledge, what advice do you have for patients, potential patients?
What I do is I have an intensive interaction the first time they come in, trying to find out if they really are transgendered or not. It's recommended that they see a psychologist as well, or social worker. It's somebody who does therapy. And if they come to me having seen somebody and they're recommended to have therapy, I do it. If they don't come to me and I think that they're a candidate, I'll have them see a psychologist or social worker and see if they agree with me, and then we just go from there.
So I know you're doing 2 presentations at this year's conference. Could we talk about your presentation on hormone therapy, and are there any other points that you made in your presentation that you'd want to share with our viewers today?
The only thing is that what I do is I just talk about what I just got through saying. But a person has to be really diligent about what they're doing, because if they aren't, I'll catch them, beat them up. Sorry. If they're trying to do too much, too fast, I'll catch them doing that too, so there's no escaping. I treat both male to female transgendered, and I deal female to male transgendered. I do with both.
And the audience at your presentation, did you feel like you were able to dispel any myths about hormone therapy? I'm kind of just curious about their reaction to your presentation.
What I wind up saying is that everything you read on the internet is nonsense. And there is no good text for hormone therapy. Everybody has their own particular perspective. I think it would be nice if we could get everybody together and come up with a generalized plan, but that doesn't happen yet. Hopefully it will one of these days, because the Endocrinology Association has come up with their own way of doing it, and I haven't seen that. I want to see it, and if I don't agree with them, I'm going to tell them I don't agree with them.
Well, thank you for being here. No doubt your presentation certainly helped patients and consumers be more educated about pursuing healthcare in this area. You also had another presentation at the conference this year about your approach to wellness and a person being at peace with themselves. I was wondering if you could share a little bit about your perspective on health and wellness, especially for transgender persons.
I think that, first of all, you need to start eating healthy. That's important. And if you have a high cholesterol or some other problem, we need to deal with that. I believe that exercise is really important, and the exercise that I think is really the best is Pilates.
What makes it, why do you like it so much? Why is that something you'd recommend?
Because you're stretching and strengthening simultaneously. And you do that, it's going to put the muscles back where they're supposed to be. It's very feminizing. And, you know, any other kind of exercise that you like to do is fine. Being one with your spirit is accepting yourself as who you are and coming to terms with that, being as comfortable as you can possibly be with who you are. And if somebody can't handle that, that's their problem, not your problem.
So what have you learned from your patients over the years, especially with regard to their own sense of being comfortable with themselves?
Usually by the time we're finished with working things out, it's like I used to say that I'm not really a doctor, I'm really a tailor, and everybody comes in some kind of trick bag. And what I try to do is to tailor it so it looks good on it. I happen to have converted to Buddhism, Taoism, from being a very conservative Christian. I think that Buddhism is very, very freeing, and that if you're raised, for instance, if you're raised Irish Catholic, you're going to be guilty about everything you do. And I don't think we ought to have guilt about what we do. And if we listen to our own spirit, it'll tell us what we ought to be doing. But you have to pay attention and listen.
Well, it certainly is nice to meet a physician with such a well-rounded perspective on health and wellness. So, Dr. Miller, I understand that you use a holistic perspective in your practice, and part of that means using herbal supplements. Could you just tell us a little bit more about that, what that means?
Well, there's two things. One is that, you know, as an allopathic physician, you use all the things that the manufacturers make. I didn't used to use herbs because you didn't know what the dosage was. Because what you do is somebody would gather the herbs and you'd either grind them up or do something with them. Now they're measurable, and so we can do a lot more with it. And I think that it just expanded my therapeutic armamentarium to do that. I've had people coming to me as transgender people who tried using the yams and soy. They may think that they're getting breasts or whatever else, but what happens is that when you draw blood, there's nothing there. It's just that what's been happening is in their imagination. So we dissuade them from that and put them on bioequivalent hormones.
So it sounds like you found a nice balance between typical Western medicine and then some traditions that we might call more Eastern in your practice. Is that a fair way of
Yes. The other thing that I do is Qigong, which comes from Taoism. And there's several different kinds. There's martial Qigong, which is essentially Tai Chi, and meditation. In addition to Qigong movements, not Tai Chi. For myself, and I think that everybody needs to be doing some kind of meditation, whether it's transcendental or yoga or whatever. I think that that will just keep you much calmer, more centered, and be able to function better.
Well, thank you for sharing everything you've learned over the years. Very, very valuable information. Thank you again, Dr. Miller.